Welcome to Zeal Nutri channel. Today we will discuss Strep A or streptococcal infection. Parents should be aware of an infection called Strep A after children in the UK died from it. So what is Strep A or Streptococcus infection? Strep A or Streptococcus pyogenes is a bacterium that can colonize the throat and skin. It causes a diverse range of skin, soft tissue, and respiratory tract infections, including scarlet fever, tonsillitis, pharyngitis, impetigo, cellulitis, pneumonia. Many people carry it harmlessly without even knowing, but they can transfer it to others, who might become ill. Transmission of Strep A. People can be transferred through close contact and from coughs and sneezes. Outbreaks can sometimes happen in places like schools and daycare homes. What is scarlet fever? It is a notifiable disease, meaning health professionals must inform local healthcare teams of suspected cases. It should be treated quickly and possible outbreaks brought under control. Scarlet fever causes a noticeable rash. It causes rash and flu-like symptoms, including a temperature, sore throat, and swollen neck glands. On darker skin, it is very difficult to detect the rash visually but will have a sandpapery feel. Patients with scarlet fever may have what doctors call a strawberry tongue, because its appearance looks a bit like a strawberry. Is Strep A dangerous? Rarely. Strep A can cause something called invasive group A streptococcal infection or IGAS. This can be deadly or life-threatening. Invasive disease happens when the bacteria cross your body's immune defenses. This can happen when you are already compromised or are on treatments, such as some cancer therapies, that affect your immune system. Warning signs of the invasive disease include fever, a high temperature above 38°C, severe muscle aches. Urgent, early medical help is essential. The UK Health Security Agency notified anyone with high fever, severe muscle aches, pain in one area of the body, and unexplained vomiting or diarrhea should call NHS 111 and seek medical help immediately. What to do if your child has symptoms? If you think your child may have any symptoms from Strep A, then you should speak with your doctor. Tell them if you have been in contact with someone who has had Strep A currently. Diagnosis. Strep A infection can be diagnosed by taking a swab of affected tissue or saliva and checking it for the presence of bacteria. A blood test can also be used later on in the illness to check if your immune system has produced certain antibodies in response to a Strep A infection. If an invasive group A infection is suspected, blood tests can be used to confirm whether there are actually bacteria in the blood, rather than just the antibodies. Treating a minor Strep A infection. Some minor Strep A infections, such as a throat infection or inner ear infection, will often get better on their own without the need for treatment. Non-steroidal anti-inflammatory drugs, NSAIDs, such as paracetamol and ibuprofen, may be used to control any pain and fever. Treating an invasive Strep A infection. Invasive Strep A infections, with the possible exception of pneumonia, are regarded as a medical emergency, and you'll need to be admitted to the hospital. The infection is usually treated with injections of antibiotics for 7 to 10 days. Occasionally, a blood transfusion may be used to help neutralize toxins produced by the bacteria. Is there a vaccine for Strep A? No. Strep A is treated with antibiotics. What is the UK doing about it? Investigations are underway following reports of an increase in infections in children over the past few weeks, particularly with some causing severe illness. Currently, there is no evidence that a new strain is circulating. Thanks for watching my video. If you like, then subscribe to my channel and share with others.